All right, everybody, welcome to Empowered Pregnancy, brought to you by Vitality Family Chiropractic out here in beautiful Thousand Oaks, California. Make sure you visit our website if you haven't already at vitalitythousandoaks.com. There you'll find more information about our practice and the amazing things that we're doing in our community. Make sure to follow us on Facebook, Twitter, and Instagram as well. I'm always posting different pictures of our practice members, testimonials, and also helpful information for you so you can live abundantly healthy lives. So let's get rolling, but before we get started, just a little bit about me. My name is Dr. Brady Salcido. I am the owner of Vitality Family Chiropractic. I was born and raised in Camarillo, California, so I'm a local boy here to the Conejo Valley. I'm a member of the International Chiropractic Pediatric Association, as well as the California Chiropractic Association. And I'm also a member of Epic Pediatrics, which is this new upcoming group that teaches chiropractors how to work specifically with kids with different neurodevelopmental disorders such as autism, ADHD, sensory processing disorder, seizures, as well as so much more. And we're just seeing phenomenal results with what we're doing. And I've spent hundreds of hours in continuing education specifically geared towards pregnant women and kids. That's really a huge, huge passion of mine. I am also Webster certified, which is specific for pregnancy, and we'll talk a little bit more about that in just a little bit here. But really, my passion for this really started from my own personal experience, and my delivery was incredibly difficult. I was born 5 weeks premature. I was born via forceps and vacuum. Pretty wild, but apparently I got stuck in the canal, and forceps weren't doing the job, so they decided to use vacuum, and I came out with a nice little cone head there. And really that started my life off on a very difficult note. I had a lot of health issues growing up. I had, constantly bloody noses, sinus infections, lots of respiratory issues. I had pneumonia in third grade, Bell's palsy, where one side of your face goes numb. And as soon as I got into high school and college and the stress started to compile on me a little bit more, I started getting regular sinus infections about once a month. And as I was playing college rugby, I was actually diagnosed with asthma. And it wasn't until I saw a chiropractor who recognized that I had interferences in my nervous system and addressed those that I was finally able to live free of all these issues that I had ever since I was a kid. And so now my passion is to make sure I'm reaching, women and children of all kinds to make sure that we can start families off with abundantly healthy lives from day one. So I'm so excited that you're watching this video, and hopefully we can save many more kids and many more women to help have the healthiest and most confident and safe births possible. Now, I run a very unique practice in that most people believe chiropractic is really just about neck pain and back pain. But if you come into my office, you'll notice that most of my office is pregnant women, kids, and entire families coming in to get care and get their nervous system and spines checked. And it's very different than what most people are used to. And you'll understand more why that is in a little bit here. So like I said, a major focus in our office is working with pediatrics, family, and pregnancy. Now, in terms of kids, our office helps children with, virtually anything: ADHD, autism, anxiety, allergies, asthma, Asperger's, acid reflux. We're just seeing phenomenal results, especially with these neurological disorders like autism, ADHD, and anxiety. We're just seeing just phenomenal results. And we also see tons of kids for bedwetting, seizures, constipations, ear infections, learning and behavioral issues, sensory processing, headaches, and so much more. And it's really amazing to see what the body is capable of when there's no interference. So my goal for you here today is really to feel empowered to have a healthy, safe, and natural pregnancy. Unfortunately, in our current society now, when women get pregnant, and I see this all the time, there all of a sudden is this cast of fear that goes over the woman. Can I do this? Can I have a natural pregnancy? Will my baby be healthy? Am I endangering my baby? And really my goal for you is to understand how chiropractic can help you have the healthiest pregnancy ever with lower labor times and a safe labor, and really get your child started with abundant health from day one. It is possible. You can do it. And that's exactly what my office is here to do, is to help you feel empowered so that you can accomplish your goals for your pregnancy. So let's get this rolling. So like I was talking about just a little bit ago, really it's kind of sad that we have this kind of shadow that looms over pregnancy nowadays about, just kind of this fear behind birth. And it's really surprising because if you really take a second to think about this, At one point, we were all just two cells. We had a sperm and an egg, and they came together, and all of a sudden we have this amazing baby. It has 5 fingers, 5 toes, eye cells where the eyes are supposed to go, skin cells where the skin's supposed to go, liver cells where the liver cell's supposed to go. I mean, do you think a liver cell would look good on your skin? Or skin cells where your eyes are supposed to be? Absolutely not, but this happens every single time. And every single time, mothers are able to do this on their very own. And really, it's just an incredible thing to see and witness that this happens every single time. And our bodies are so intelligent and so capable of doing this, but sometimes we forget how incredible we are. And I mean, do you even think about your heart beating? Do you think about your lungs breathing? Do you think about healing a cut? Do you consciously think about these things happening? Or even digesting your food when you eat a sandwich, let's say. Do you think about breaking all those nutrients down and putting them exactly where they need to go? Of course not. Your body does that on its own, right? Or even if a toxin were to come into your body, say you ate some really bad food, what does your body do? Your body expresses this intelligence that's within it and tries to get those toxins out. So you vomit, try to remove those toxins. And one of the greatest examples is when someone gets the flu. A lot of times we talk about, suppressing these symptoms, the runny noses and the fevers. But what are these symptoms really? These symptoms are our body's natural alarm system letting us know that something's going on. And this is our body's way of attacking and adapting to this new stress. So for instance, a fever, anytime we have a virus in our system, our body responds in order to kill that virus. The only way to do that is to raise the heat. And that's what a fever is raising the internal temperature of the body to destroy that virus. So if you have a fever, that's a good thing. That's your body adapting to stress and fighting. So that's a good thing. We don't want to suppress that. And there's so many more things we can go into. Even if you were to go on a run and you run and your body naturally sweats and tries to cool itself off. I mean, this is just the incredible intelligence that's within every single human being. And I think it's even more so evident with a pregnant mother. And chiropractors have given a term to this, and they call this the innate intelligence of the body. And this isn't a spiritual or voodoo type of thing. This is truly this intelligence of your body, and we've really given a name to it. It's called the innate intelligence that every single person is born with. From day one, you have this, and this is what allows you to function, adapt, and even heal normally. So anytime we're talking about, what's allowing our bodies to function, we're thinking about how this innate intelligence is able to work on our body. There's really one main thing that we're looking at. And if you had to think of one main thing that controls your entire body, what would you say that is? And one of the most common ones I get is your heart, but it's not your heart, it is your brain. Your brain is the most important system in your entire body, controls every single thing. And your brain sits up here in your skull, obviously, and your brain is constantly sending messages down your spinal cord and out through these little nerves that go out to every single organ, tissue, even cell of your entire body. This is how your brain is constantly knowing what exactly is going on. Studies show that there's anywhere between, I think it's 50 to 70 trillion cells in your body at one time that your brain has to be aware of and has to coordinate at any given time. And each one of these cells, there's hundreds of processes going on that are allowing your body to function and be healthy. But if we were to say, sever one of these nerves that go to your heart or to your lungs, what would happen to those organs? They would not be able to function normally, right? If function at all. But let's even take that down just a notch, and let's say we had some pressure on this nerve, and it's interfering with those signals that are going from the brain to the heart. That's going to interfere with the heart's ability to function at 100% of our potential. So how does the spine fit into all this? Well, if there are misalignments in your spine, or what we as chiropractors call the subluxation, that's going to interfere with that proper connection between your brain and your body. And that's really going to rob your body of optimal health. So my job as a chiropractor is to restore that connection, is to remove the interference in the nervous system and allow your body to express health at 100%. Sorry for the cheesy photo there. But really my job is to restore that connection so that your body can restore normal function and normal connection. And if we think about this connection has never been more important or intimate than during pregnancy. Because mom, as that baby is growing in your womb, that baby is intimately connected to your innate intelligence, intimately connected to your nervous system. So that's why you hear how mothers are so in tune with the baby. I will trust a mother over any doctor any day, because that mother intimately knows what is going on with that child at any given time. And this really is a very intimate connection. So it's extremely important that we have these lines of communication absolutely clear for the mother's innate intelligence to fully coordinate with that developing baby in your womb, and to be able to allow that baby to grow and develop optimally in the womb. And this is where we start getting into the Webster techniques. So my first job is obviously to restore that connection to the nervous system. But when we're working with pregnant women, we also take it a step further, and this is where the Webster technique comes into play. Now, the Webster technique is a very specific and gentle technique geared specifically for pregnant women. And its job is to reduce the interference to the nervous system. That's my first job. But what it also does is helps balance the pelvis as well as the muscles and ligaments that surround the uterus. And this is a very, very successful technique in working with pregnant women. It's very successful in low back pain, but it's also been extremely successful with breech pregnancies. And one of the main things that it was used for was not to turn babies or not to move babies, but really the main point behind the Webster technique is to remove any type of stress that is on the uterus, to allow the uterus to expand to its optimal position and give the baby plenty of room to grow and develop without any type of intrauterine constraint being put on it. And so if we're looking here at the pelvis, here's your pelvis, and we have one side of your pelvis here, another side of your pelvis here, and your sacrum right here. Now this sacrum is extremely important during pregnancy, because if you see these little holes right here, these are your sacral nerves that come out and actually supply the uterus. This is where the uterus gets its supply from the brain from. So it's very important that this sacrum is in its optimal alignment and optimal positioning, because if there is a subluxation present in that sacrum, that is going to adversely affect the uterus, not allowing your uterus to get to its optimal position, and therefore affecting that baby's growth and development inside the uterus, and possibly even affecting the baby's positioning. So my goal is to make sure that that is in its optimal alignment, because if it's not, that's going to affect everything around there. And there's all these ligaments that come from the pelvis and attach to the uterus, which sits right in through there. So really the goal of the Webster technique is to establish pelvic balance and alignment, optimizing room for the baby to grow and develop, like I was saying before. And this is going to allow the baby to achieve optimal position. So once again, during breech pregnancies, I get lots of mothers that come in with breech positionings. Really our goal isn't to move the baby or to turn the baby, but really to give that necessary room for the baby to realize that there is plenty of room and to get into that optimal positioning once again. And we've seen just incredible success using this technique. And this minimizes the potential for dystocia. So if we have plenty of room for that baby to grow and develop, we're not going to have these difficult or prolonged labors. It's going to allow for proper movement of the pelvis. So during labor, that's going to allow for that optimal movement and waves of contraction that we need to see during labor. And what this does is it results in easier and safer deliveries for, one, the mother, absolutely, but also for the baby too. And our goal is to make sure that we reduce those risks for C-sections. C-sections can be incredibly difficult, not just for mom, but especially for the baby. We've seen studies that show a major correlation between C-section deliveries and asthma. And there's a whole another workshop I do talking about how C-sections actually affect the child. And one of the main issues with a C-section, but first let me say the C-section has its place, absolutely. So I don't think I'm trying to bash C-sections alone. They do have their place in very emergency situations. But the problem with C-section is instead of the mother being able to push the baby and the doctor guiding that baby out, now what you have is a doctor that needs to pull that baby out while the mother's womb actually creates a sort of vacuum. So what we really have is opposite forces that are pulling the baby, and unfortunately the point of leverage for that child is in their neck, which actually holds the brainstem, which can cause a lot of issues for that child early on in life. And so our goal is to make sure that we reduce these risks in C-section. And if there is a C-section, then we make sure we get that child checked by a pediatric chiropractor as soon as possible. And so really our goal is to reduce the incidence of birth trauma. And that's going to help our children live healthier lives immediately from day one. So here are some common questions and concerns I get when pregnant women come in and they have concerns about the type of care that they are going to be getting in the office. And the first one is, will it hurt my baby? I get women who are at 38, 39 weeks. They're getting large again, ready to deliver. And the first question is, will it hurt my baby? And my answer is absolutely not. The techniques we use in our office are extremely gentle. You won't be feeling much force at all in your spine. It's not going to be hurting the baby at all. Really, it's going to be a lot of gentle pressure and gentle force into the spine just to allow those vertebrae to get to their optimal positioning, remove those subluxations, and restore that very intimate connection between the brain and the body, as well as you and your developing beautiful, beautiful baby. And the second one, most common one, are adjustments painful, and how are they done? Adjustments are not painful. They're extremely gentle. I have a wide variety of techniques that I use in my office, as well as many other chiropractors who specialize in the Webster technique. And really, the adjustments are done in several ways. So originally what we do is we have you go face down on our tables, but we have a pregnancy pillow there, which our pregnant women love. And really what it does is it allows the table to drop underneath, leaving room for your belly. And the pillow is really there to stabilize your belly, stabilize the baby so you can feel comfortable going into that position. And it really places very minimal pressure on your abdomen, if any at all, but our women love it in our practice. Should I have my child checked? And if so, when is a good time to get checked? Absolutely, we should have our children checked. Many times people realize that the birthing process is very difficult for the mom. We absolutely realize that. But a lot of times we forget it can be very traumatic and very stressful for a child, especially on a very delicate spine and nervous system. These children, their spines are more like cartilage, so they're very delicate. And I have this quote down here: as the twig is bent, so grows the tree. And if we create these subluxations from very early on, so early on in this birthing process, which we see a lot of the times, then what happens is these subluxations start to inhibit this child's ability to express optimal health from day one. So we always recommend that children get checked, even in natural births where everything seems to be going completely fine. I always recommend the child at least get checked to see if there are any subluxations present. So what are the benefits of chiropractic care? I call these the side effects of chiropractic care. What will it do for you? Well, first off, better energy. If we have a clear and fully connected nervous system, that is going to give you better energy and just better stamina throughout the day, especially as you're needing a lot more of that energy to take care of that child. And less pain. A lot of women complain of that lower back pain, especially later on during the pregnancy, and you'll have much less of that. And our goal, obviously, is many women also say that they have quicker, easier, and safer deliveries. Our record right now in the office is a 45-minute labor, so if you can top that, I would be so incredibly excited for you. And really, one of the benefits is it makes you feel more confident in your ability to deliver. Knowing that your spine, your nervous system, and your pelvis are in their optimal position to get ready to deliver really should give you a boost of confidence in your ability to have that natural labor that you're looking for. And less risk for C-section. I know a lot of women are worried about having that C-section, and our goal is really to reduce any type of risk for that so that you can feel confident and comfortable going into your pregnancy and your delivery. And obviously, we want to make sure there's a clear line of communication between you and your baby. As that baby is growing and developing, I want to make sure that you two are intimately connected and establishing that from day one. And really, the main reason why we want healthier pregnancies is, one, for the mom, but also more importantly, we want to give that baby the healthiest start into life from day one. If we can minimize the chance for these subluxations to happen to our children from day one, we can start them off from the best health possible right from the get-go. And that's really our ultimate goal. So I want to thank you for watching this video. It's a very simple, short video, but hopefully this will give you a little bit of an intro to how chiropractic can empower you during your pregnancy. And if you are interested in checking us out and experiencing chiropractic for yourself and your pregnancy, make sure you give us a call here at our office and subscribe to our newsletter. I'm always sending out very helpful information that I'm sure you'll love, especially for a natural birth and just living more abundant and healthy lives. So thank you so much for tuning in with us today, and I hope you have a phenomenal day.